I've had compressed sense for the last 10 months and it's been such a joy to use. It just seems to be like another extension of parallel imaging that we're currently using with similar sense factors, but instead we're using compressed sense factors to utilize our parameters. Compressed sense has transformed pediatric MRI imaging. It's made the scan time much quicker, therefore overall exam time much quicker as well. And that further reduces the general anesthetic time for pediatric patients that need for GAs, as well as you can increase the resolution, which we can see smaller structures a lot better, and having that ability to cover range has been a godsend. Now, it's so easy to increase the resolution with compressed sense because what I've found is just by turning it on, it already increases the signal and further improves the resolution. The main benefit of compressed sense is reducing the scan time, and the benefit of scanning at 3 Tesla is the extra signal to play with, and balanced with compressed sense just makes this ultimate partnership to make the overall scan time much quicker. So the great things about compressed sense is you have 3 different ways to play with. You can use it for resolution, you can use it for scan time, and you can increase the scan range. And being a pediatric MRI radiographer, it's unpredictable. So this is the fun part, where you can adjust the parameters, use the signal to play with, and use compressed sense to balance that together and bring a better image quality. So compressed sense has been the ultimate tool because we have been using in all body regions and nearly all sequences except for diffusion, and we can't wait for the day that multi-vein can be used with compressed sense because that will be the game changer in pediatric MRI. Another major benefit of compressed sense is the kids don't have to hold their breath for that long. Ranging from 15 seconds to 9 seconds is a major difference. Even I can't hold my breath for the 15 seconds. Now I'm going to talk about the tips, tricks and traps of using compressed sense. You want to start with a lower compressed sense factor and work your way up to see how much signal you can play with. Being at 3T, have extra signal to play with, which has been great. Another tip is just by turning the compressed sense on, you will gain that extra signal. When you have extra signal, you can make the scan quicker or increase that resolution that you need. And this will be perfect for general aesthetic settings to improve that resolution when the kid can keep still. Another tip is with the high contrast, black and white contrast scans, you can increase the factor to a higher factor. For example, with the face contrast imaging or your T2 drives, you can push a little bit higher and you reap the rewards having a much faster scan from 5 minutes to even around 2 minutes time. Another beauty of compressed sense is you really utilize the 3D imaging as well. Having a higher signal, you can use that to improve your resolution once again and make the scan time much quicker. Turning on compressed sense has never been easier. You just need to turn off DS sense and turn on compressed sense, and that's all you need to do. The factors will factor in, and that's where the fun begins. That's where you alter the factors and using the signal that you have and to improve your scan time or resolution. If you're just starting using compressed sense, another recommendation is with the reduced overall scan time, you can do one without and one with, or with different compressed sense factors to see what changes it does. Now the first trap I have is I don't usually use compressed sense when there's metal artifact present, especially kids with braces. This is due to the undersampling of compressed sense, and it will make the metal artifact a lot worse. Another recommendation not to use compressed sense is through the thoracic spine region, as the heart can produce extra artifact into the image. Compressed sense can be used in fetal MR. However, I don't tend to use compressed sense in fetuses around 20 weeks. Sometimes with low signal, it can bring more noise into the picture, and that can affect the image quality. Another major concern for compressed sense is our pediatric patients never get to watch more than 15 minutes of a movie, and that's a major problem. Now, it was so easy to learn about compressed sense, it only took me a day to implement into our workflow. Compressed sense brings efficiency into our daily routine, and it's just as easy to implement on the spot, especially dealing with pediatric patients. If they move, then we can use that to ultimately make the scan quicker. By changing the parameters for compressed sense, it's never been easier. It's just one click of a button and you're set. Now, due to the robustness of compressed sense, every exam card has compressed sense on it. because we can use it in all different body regions, and this has made pediatric imaging so much easier. Compressed sensors is such a powerful tool to have, and it has transformed MRI pediatric imaging. And this is a special tool that we can't live without anymore. Now, pediatric patients love magic. Now, I think compressed sensors is magical. The ability to bring reduced scan time and enhances spatial resolution, it further enhances the user experience, and more importantly, it brings a better experience for our vulnerable patients and their family. The initial experience having compressed sensors on board has been amazing. This past 10 months has reduced scan times for pediatric MRI imaging and further improved our image quality as well. And this has been a game changer in pediatric MRI imaging.